And it's just a gentle movement now, over and back. Now we'll stretch right back. So we'll really open out the thoracic.
Patricia Hegarty, I'm a sports therapist.
There you go. Everyone loves it. Immediately once the stretch back, it just, opens it all up. Any little cracks there?
Yeah.
There you go. We go to number 2.
Yeah.
Engage your core a little bit. Slide right down. Take out the roller at the back. Put that under your bum. And grab the frame at the back so you get a lovely stretch now as well on the shoulders as you pull it through. And you really go deep. And generally when I'm doing this, I'll count 10. So I'll go 1, 2, 3. So drop your lat onto it like that, and we're going to just stretch it back, so we're going to open it out. Just leave it back like so. Yeah, look at the incredible flexibility you have there. Happy enough? Jump onto the glute. And the fact you have a stretch across, you're really activating it.
This is going to help. Next time.
There you go. Just kind of dig it into the edge and try this. Get some active release going, kick it out. Just 1, 2, we'll go for 10, 3. Now swing it around. Remember, we've just rolled our glute, so we can continue the stretch and the release on that by bringing it across and dropping it down like so. So all the time, you're working through the body in a very effective way, getting the release, stretching it out, opening out any tight tendons or anything that's pulling. You're just unlocking everything. Complete body release. Onto our IT. Now obviously I'm very used to it, so no bother. So it's one hand and one elbow.
Yeah.
So your elbow keeps you low, your hand gives you the leverage. Fabulous. Now come out onto your quad. And from the knee right up into your hip.
Okay.
And again now, one hand, one elbow to control the force. Now one other thing you can do there on the TFL, just get a bit of active release going like that. Super, brilliant. The release you get there is invaluable.
If people had a foam roller and they used it, I would be out of a job.
Well, it's not you're out of a job. You know, somebody still has to educate people because they need to be assured all the time we're doing things right, we're progressing in the most effective manner we can, and they will be thankful to you forevermore.
Right. And it is for the good of their muscles.
Effective movement is invaluable. If we can move well, there's no price on that. Now, we've 3 left. Drop your adductor onto it and get right into it there like that. You grab the frame, yeah, you've fabulous control over it then. You can pull right into it, get in quite deep.
Yeah.
Last 2 then, we're onto the lower limb. So our calf. Now just slide your bum along the floor. We don't want to pull the arms off ourselves. Nice and easy, down through the calf, yeah. You can bring the foot right in now as well, so you go right through the body of the soleus like that. And really unlock it. You're feeling that? Class. Tibialis anterior that comes down the shin. You'll see runners and people who come back to exercise, even just walking, straight away what hits them? Shin splints. If you get all your weight on it, Patricia, there you go. 1, 2, 3, 4, 5, 6, 7, 10.
I really feel that working. I really, really love it.
Awesome. Are you going to have one?
Yes, definitely.
It felt far superior to all the other foam rollers that I've used in the past. I like the fact that you can get into a lot of areas that you can't get into with a normal foam roller, such as the upper back and the neck area. Sport-wise, I run, I dance and do yoga, and I get a lot of tight areas, and I just felt like this really worked to get into those areas. I've also got kids who do quite a lot of sport, and I know that they'll use the baller as well.
I feel the difference in someone's muscles that come into my clinic. I'm like, what are you doing differently? And they say, well, I foam roll every day. And I say, well, that's why your muscles feel so good. A lot of my clients actually have come in themselves. I've purchased this great thing called the back baller. They're actually making use of it every day because it's easy to use.
My son does martial arts, so he gets a lot of adductor tightness from all the kicking that he does, and a lot of tightness around the hips.
A lot of people that come to my clinic, they're not 20, they're not athletes. They're maybe in their 60s, they're maybe 50. They're still doing a wee bit of exercise, they're doing hill walking. They're not confident on a normal foam roller because of the instability of it. So they maybe have a hip injury or a back injury and they don't feel stable to be pivoted on a normal foam roller. So the beauty about this is that it's stable, that they're not actually worried that this thing's going to skate from under me and I'm going to be injured further. And this is the difference in this than a normal foam roller.
If the fascia's tight, then you're not going to function effectively. If you're tight in one area, because we know the muscles work in slings, it's going to have an effect all the way through the kinetic chains.
Anyone that does it, I can physically feel the difference in their muscles.
And it can have quick gains on back pain, hip pain, leg pain. Fantastic for tendinopathies as well. So if we're loosening areas and getting into those tight areas of tissue and actually getting those lines of fascia moving, then we're actually releasing things and having a positive impact.
No sense buying a 20-pound foam roller that's going to sit in the corner. Buy the back baller and you're going to use this every day. Your whole family's going to use it, so you're getting full value for money.
It might keep you out of my clinic, it might do me out of a job, but it will complement any kind of therapy program that you're working with. It's well worth buying.
Every exercise from 1 to 10, 2 minutes, you can't get it wrong. Michael presented to me with lower back pain. He was getting booked in for surgery, which he didn't want, and he says, this is the last resort. I can't put on my socks and shoes. I've lived with this for about 8 or 9 years. He had a few weeks treatment with me. We started the foam rolling, recommended the back baller, which he now uses every day, and his life has totally transformed. If he hadn't have started this back balling routine and started his foam rolling routine now, his life wouldn't have been worth living.
He'd probably be after surgery.
He would have been after surgery.
Yeah, that's my story as well. Same thing.
Once they cut through the muscle, that scar is never right.
Yeah.
It causes dysfunction throughout the body, throughout the muscles around. You don't realise actually you're making a difference to people's lives.
No, that's quite a compliment. Thank you. Of course, it requires commitment. Every day, if you can, get out, do a little bit on it. Just make it part of your life, and you.
It's an enjoyable experience, it's not.
Well, it is, yeah, because you actively feel the release as you do it. So it's great. Thanks so much.
Right.
What a story! So good. Love this lady.